Well, happy Monday, everybody. Now, listen, many people are looking for a way to stop the hands of time and fight the signs of aging.
Well, let's be honest. We see some celebrities out there with that kind of frozen look.
Yeah.
Or you thought, going under the knife is not for me. It kind of keeps people from getting what they want. But that is why Dr. Jody Comstock is here to tell us about a great alternative. Doctor, thank you so much for coming here.
It's great to be here. Thank you for inviting me.
You know what? Let's start from the basics. Let's start out with, why is it that we get these lines and wrinkles? What's causing us to go, in the mirror when we see them?
As we age, it's multifactorial. And sometimes it is your age, it's your genetics, stress, and for all of us in Tucson, it's the ultraviolet damage. It really accelerates some of the lines and wrinkles.
Really? Okay, so I know one of the things we're here to talk about are neurotoxins. So for anybody who's never heard of that, what is that and kind of who's the ideal candidate for it?
So neurotoxins are medicines that temporarily immobilize muscles that we use on our face. And so they've been around and FDA approved for a while, very safe. Everyone is a good candidate, men, women, younger, older. And what it does is it gives a natural look of temporarily immobilizing the muscles. And I think most people are familiar with the frown lines and immobilizing those muscles.
And so if this sounds like something we would love, to try, or like we said, we would love to get that beautiful, younger look, what kind of healthcare providers could do this for us?
It's always great to go to a board-certified physician. Those individuals have gone through adequate training, they're certified. Also, you can look at the websites of companies that you're interested in. They will list physicians, for example. Some are trainers, some have a lot of experience, and that's also a great way to know where to go. And one little trick is looking at the staff of where you go. The staff looks great. It's a great sign that you're going to be in good hands.
Well, Doctor, you look great. I've been noticing for the last several minutes. And I'm really glad that we're really kind of talking about that frozen look and how that's not really what people are going for when they're trying to get rid of their lines and their wrinkles. So maybe kind of talk to us about what patients can expect from the treatments and what it'll look like, how long after, you start to see results.
Well, oftentimes neuromodulators or neurotoxins are the first entryway into a cosmetic procedure. So individuals come in and they're feeling like they look crabby or unhappy or older. And so it's just a natural way for you to enter into the treatment. It occurs in 2 to 5 days where you see the softening when you have your injections.
And I know we're looking at some before and after.
Right.
You know what, I'm going to be honest, from the before and the after, they do kind of look just happier. The
do.
face looks softer and happy.
Oftentimes when our patients come in, one of the first things is that their friends or coworkers are saying, you look tired, you look unhappy, what's the matter? And oftentimes people are happy in their heart. They're just seeing the muscle movement over a period of time that has created a frown.
And I think what's fascinating as we're looking at these before and after pictures is the after pictures, they look like normal people.
Yes.
They really do. There's nothing frozen or fake looking about them. And I think that is really the selling point here. So I know a lot of people watching are probably thinking, is this something that's actually safe? Yes. So can you kind of talk to us about that and what maybe people should know about this?
Well, all the neuromodulators have a box warning, and so there are always side effects to everything that you do. They're very few, but you could have potentially a headache, eyelid swelling, eyelid drooping, sinus irritation, throat, nose irritation, respiratory issues, or you could have just some nausea. Again, those are not common, but they are things that we do talk to our patients about.
So if somebody out there is like, okay, you know what, I want to get more information, I want to get a little bit more educated, what's the first step? Is it to go online? Is it to give you a call?
Actually, a lot of people go online. They'll listen to shows like Morning Blend, or they'll go and check out Real Self. And I think going to a physician's website is always a great idea. And there are oftentimes some questions and answers, but I think it's always a great idea to get a consultation, to sit down with a provider, because sometimes there are other healthy things you can do to enhance your skin and to really feel the best about yourself.
I love that. A consultation for sure is going to help everybody. Now, being new to this myself, what are some of the areas that you might target for somebody, a first-time patient, let's say?
For a first-time patient, we always look globally at the skin. Healthy skin wins the game. And interestingly, our eyes go for symmetry and facial shape. So we talk to patients about that. And we always address healthy lifestyle and healthy skincare program. And then we talk to patients about neuromodulators. They might need a filler. We address other things that might enhance their look, and also listen to what their goals are. If they're getting married or something is coming up, they may have shorter goals than longer goals.
Oh, she's talking directly to me.
She sure is.
I am, Tina.
And that is something that a lot of people are thinking about. Maybe I have a reunion coming up or a wedding coming up.
Class reunions are a big one. Weddings are even bigger. And what you want to do is always test it before the actual date. You never want to do it the week before the wedding.
Absolutely. Now, doctor, before I let you go, is this something that is going to be painful for people? Is it quite uncomfortable or not?
Actually, the procedure itself just takes a few minutes. Most of our patients come in, lunch, out the door,
Wow.
and they're always worried that someone will know what they've done. And no one does. They usually notice, oh my gosh, your hair looks great. Have you lost weight? No one notices what they've had done. And people are always nervous because it only lasts 3 to 6 months. And then they're so happy that it looks great. And it's usually something people choose to do a couple times a year.
Amazing. Well, doctor, I'm so glad you joined us to kind of clear up some of those questions that we've all been having. Thank you so much.
Nice to chat with you. Bye, Heather. Bye, Tina.
And to learn more information about fighting the signs of aging, you can call 797-8885 or log on to skinspectrum.com.